Hospitals in China are seen as a quite new trend globally. Medical tourism from abroad, from Europe, from the US, even from countries with free healthcare. So why are people flying to China for treatments? To understand that, you first need to understand how healthcare works for ordinary Chinese people. And everything starts with one key thing. That is China's basic medical insurance system, which we call it Yibao. The easiest way to understand the system is to think of it as a personal saving account. It's linked to your national ID. So it's just one person, one ID, one insurance account. Once you start working in China, a small part of your salary will be automatically saved to this medical accounts. So every month, both you and your employer needs to contribute to that account. Let's try to put numbers on it. Let's say the average monthly income of a Chinese worker is around $500. You personally need to contribute 2% of your salary into this account, and your employer actually need to contribute a bigger portion, 8%. So that's around $10 from you and another $40 from your employers. Total $50 into your medical accounts every month. And this $50 is very specifically for your medical needs. And this insurance works only for public hospitals. And China has over 12,000 public hospitals, which make up around 35% of all the registered hospitals. It covers most essentials like doctor visits, common medications, lab tests like CT, MRI, body check, and hospital stays if necessary. But here is also another key thing. It is not 100% free. You pay it first and then you get reimbursed. And typically around 50 to 90% of the cost can be reimbursed. That's a lot, right? And the percentage really depends on which hospital and what level of hospitals you are going to. There are two rules that really matter. First, the deductible. You need to pay a certain amount of money each year before you can get reimbursement starts. That's usually $70 to $200 every year. Second, the annual cap. So there is a maximum reimbursement amount that the system can do for you every year. That is around 30,000 to 60,000. And you will ask, what is the goal of this system? Answer is, it's not for luxury care. It is not comfort. It's working for the coverage. The idea is simple, the basic, very affordable healthcare for the general public. And on that front, it works. Coverage is close to almost universal. So public hospitals, it can be very crowded. It can be like a factory, but the system itself working extremely well. It's efficient and it's very tech-driven. App-based bookings, mobile payments, and digital reimbursement. And one thing we often underrate is the government negotiate really hard to bring down the medicine price. That's why many medicines are actually cheaper than foreign countries, dramatically cheaper, because we want the general public can afford it. Now let's go back to the foreign medical tourists. You are certainly not a part of our medical insurance system, right? So how can you see doctors? Actually, you just need to do two things. First, go to a public hospital with international department, or you can choose a private hospital. Don't be worried if you want to do it like us. You can use your translation app or just getting an English-speaking local, just like me. The whole process is extremely simple. You book an appointment, often in English. They have English websites and the apps have English language as well. Bring your passport because you need to register at the hospital. And then after everything, you need to pay from your own pocket. Even without the Chinese insurance system, you don't have the ID, but the total price can be surprisingly cheap compared to so many Western countries. Let's say $100 as the cap, including lab tests and body checks like CT. $100 maximum. And I think the biggest surprise can be it will not take you a few months to see an expert. You can easily go see an expert in 1 or 2 days. Even though you have to wait, that will be no longer than 1 or 2 weeks. Most of the times, you can just finish that in 1 or 2 days. China's medical insurance system isn't mystery or propaganda. It's about modern facilities with relatively low costs, but more speed and efficiency. I won't say China has a perfect healthcare system because it's not designed to be luxury care, right? But for most of the non-urgent treatments or for people facing long waiting times back home, this is a real deal and a real option. So I'm really curious, would you be a medical tourist? Or have you ever experienced healthcare in China by yourself? Share your thoughts below in the comment. I will read them carefully.